Hey everyone, welcome back to our channel. Today, we are going to explore the step-by-step process of IVF, in vitro fertilization, a procedure that helps many individuals and couples achieve their dream of starting a family. Step 1. Ovarian stimulation. The IVF process usually begins with ovarian stimulation. This involves the administration of fertility medications to stimulate the ovaries to produce multiple eggs instead of the usual one per cycle. Step 2. Egg retrieval. Once the eggs are mature, a minor surgical procedure called egg retrieval takes place. This involves extracting the eggs from the ovaries using a small needle guided by ultrasound. Step 3. Sperm collection and fertilization. At this stage, sperm is collected and used to fertilize the retrieved eggs in a laboratory setting. The sperm can come from a partner or a donor. Step 4. Embryo cultivation. The fertilized eggs, now embryos, are monitored and cultured in a laboratory for several days. Step 5. Embryo transfer. The final step involves the transfer of the developed embryos into the uterus. This is a relatively simple procedure that usually doesn't require anesthesia. But in some cases, where patients experience pain or difficulty, the transfer is done under anesthesia. Step 6. Pregnancy test. After a waiting period, 2-week wait, a pregnancy test is conducted to determine if the procedure was successful. Need help getting pregnant? Send us your medical details by filling out our free second opinion form. For any other queries, contact us on our WhatsApp number. If you found this video helpful, don't forget to give it a thumbs up and subscribe for more informative content. Thanks for watching.